We're talking about fake botox. It's been the cause of bad reactions now in 9 states, and that includes Colorado.
A new report out by the FDA says the products were given at unlicensed sources. So answering more of our questions is 9 health expert Dr. Pyle Coley. And now let's all begin with the fact that all these people were treated in a non-clinical type of setting.
Yes, exactly right. So some were homes, some were spas. And I think it's really important to be having this conversation because we think about Botox as a cosmetic treatment, which it largely is. In fact, 18 out of 19 of these women got it for cosmetic, but it's a medical procedure as well. And one of the concerns that the FDA raised was not just about the setting where the intervention was done by unlicensed professionals, but also that what was injected could have been fake Botox, counterfeit Botox, purchased from unlicensed sources, which is why it's wreaking havoc on these people's
And
bodies.
what is it then?
So it could be either the concentration is incorrect, it could be that it's contaminated with something else, but because it was possibly not actually authentic FDA-approved Botox, the way that it spreads inside the body is also what's really problematic.
That's the difference between taking a pill or buying something over the counter. You have no idea what's being injected into you. I mean, you never have any way of knowing what's in there unless you go to a licensed operation.
Right, and you got to ask the right questions, Tom. And in fact, there are clues on the vial that the FDA and CDC have put out that can tell you that it might not be the correct product. So the dosage is one, for example. So 150 milligrams is not a dosage that Botox comes in terms of the vial. So if the place that you're going to is using that can raise a red flag. The lot number that they're using on the vial is the exact same one, because it's not actually a real lot number, it's a made-up lot number. So looking at that, and then what they're calling the toxin itself, the name of the toxin is not Botox toxin A, that's not what the actual drug is labeled as.
So that's the thing. I mean, people have used Botox for cosmetic and for other purposes, but when you think of the name, it's botulism and toxin put together. Either of those may be bad for you if they're not used properly.
Exactly right. I mean, this is a toxin we're injecting into our faces, and it's become really culturally popular. We do it all the time. But what it does is it paralyzes the muscles. So it breaks off the communication between the nerves and the muscles. And it does this in our forehead and our crow's feet and our smile lines. And that way we can flatten out the wrinkles. But when it moves from those areas into our eyelids, where we can't hold our eyes open, into our breathing muscles or our swallowing muscles, where we can't talk, we have slurred speech, we can't breathe properly, we could actually die from botulism. And people got admitted to the hospital with this.
And that's it being improperly administrated, not necessarily with what was in there. That's a separate problem altogether. So you already hit on some of the symptoms. How do you know if you've been misapplied, if you will?
I mean, if you're having any of these symptoms, a droopy face, a droopy eye, trouble speaking, slurred speech, generalized weakness, trouble breathing, you need to call the hospital right away. In fact, many of these women did call the hospital right away, and several got admitted, 60% got admitted. Many even got given antitoxin. So there's a way to treat an overdose of Botox. Botox poisoning is what this was. And that's by giving them an IV medication that actually sops up the extra toxin. So it doesn't affect what's already been taken up by the nerves. It can't reverse that, but it prevents more damage from occurring and can be a life-saving treatment.
That's what I was wondering, is what do you do? I mean, once it's in you, I mean, there are not a lot of chances to fix that.
Well, this intravenous thing will prevent more toxin from acting, which is why you got to move quickly. Because as you know, Botox, when it gets injected, within a few hours gets taken up, but it really starts to have its peak effect within a week or so. So it's still working. It's outside of the nerves. It hasn't poisoned your nerves yet. But when it starts poisoning the wrong nerves, you got to reverse that very quickly by preventing further damage and supporting the organs. So for example, if you're having trouble breathing, you get put on a breathing machine. But it is important to address this, and really important to realize this is not just a cosmetic treatment that any old spa can do, someone can do from their garage, you can order from Amazon. This is a medical procedure that could have really life-threatening consequences.
I think I read an article like a year ago where they talked about the parties.
Yes.
And all I was thinking is, oh my gosh, give me a glass of wine, I might make some really poor decisions. And that's just not a good decision.
It's not. Even the way that it's drawn up and formulated. So if you're going to get Botox, which is an FDA-approved treatment for wrinkles and fine lines, make sure you're going to a licensed provider, make sure you're asking those questions, and make sure you're looking at the vial of what's being injected. Oftentimes we just trust people. You have to have a license to inject this. An esthetician cannot inject Botox, and don't let them talk you into it.
All right, good advice as always, Dr. Pyle Coley. Of course, you can find more health news with Dr. Coley by visiting 9news.com/Dr. Coley.